am a stage 4 pancreatic neuroendocrine patient. I went to a GP and explained that I had a stomach ache. His reaction was, "Oh, is that all?" This process was repeated over a year or two. Having the best care, I think, is 80% of survivorship, and the other 20% is just remaining positive.
I was diagnosed with MS. It was obviously a difficult time for me and my family. And in addition to that, my neurologist said if I didn't get on medication within the next 12 months, that I would be in a wheelchair. Unless it comes on the PBS, then we can't probably do that treatment yet. Early diagnosis is so key. Innovative therapies have managed to reverse my lesions. Early treatment has meant that I can walk and talk and jump out of planes. And education is so key, not only for our healthcare professionals, but scared, confused patients that have to go through this system.
Medicines Australia's Compare report shows that very clearly. And it now takes about 4 times as long to get a medicine onto the PBS as it does in those global leading countries that we would really like to be comparing ourselves to, like Japan, the UK and Germany.
All of these things are about the hope and the access and the health and the outcomes and the humanity. So that's why this is so important. What an unimaginable privilege and role that you play.
Medicines Australia really wants to stand up for patients and the patient voice. Patients need to be heard in the system so that when we get new treatments, they are made available as quickly as possible for the patients who need them.
I think the key themes that came across today were the need to have the patient as part of the entire care continuum.
It is the patients that drive what we should be doing.
Collaboration has to be where we start, that we have to have everybody at the table, and that has to include patients.
The old system is not going to hold true for where we need to go moving forward, so we need to challenge the paradigm. We need to look at new ways in the healthcare system that we're working within.
Events like this are really important because the industry has a role in making sure that people get together. It's a partnership, and through that partnership we can ensure that really innovative medicines can come to those patients that really need them in the fastest possible way.
Today's event is such a special moment in time where you're bringing together people who really care about getting medicines to patients as fast as possible.
Key takeout's the real lived experience. At the end of the day, there's nothing better than patients telling it as it is and telling us how we can improve or how the system can improve from their perspective.
We need to get patients involved at the clinical trial end and get their voice heard really early on.
Early and accurate diagnosis is critical. Early access to treatment is critical. And we need a healthcare system that is fit for purpose, that's going to serve us in the next 100 years as well as it served us in the last 50.
Each and every one of you in this room is engaged every single day in saving people's lives. So I'd like to take the opportunity to thank you all for your life-saving work. Thank you for coming to this tremendous event tonight. Thank you for making room for the patient's view.